voluma in her cheeks. And this, to me, this is the most important area to use filler. We all lose fat in our faces, and so by putting some volume back, it's very rejuvenating, and it really helps the patients look better and feel better. So I like to sit the patient up a little bit higher to give me the best angle. And this is an area where actually doing surgery, I think, gives me a better result for the patient than someone who doesn't do surgery, because I know the anatomy and I know where I'm going to. There's a compartment here that's kind of formed in this manner, and so I can put the filler right into that compartment, and it's deeper than what a lot of people would normally inject. So I use a cannula. What that means is I take this needle to make a little puncture, and then the cannula has a blunt tip on it so it doesn't hurt and it doesn't stab blood vessels or cause bruising. It's very safe. It's much safer than using a needle. And then Adriana will take that needle out, and now I use that hole that was made by the needle to insert my cannula. Now there's a muscle layer called the SMAS, and I want to be beneath that muscle layer because that's where the fat compartment is, where the fat's gone away. So I can feel it pop into that space. Now I'm in that space. The space is kind of defined by the drawings I've done here. So I push up and I hit the top of that space. I can push down and I hit the bottom of the space, and I know that I'm in that space, right? And then basically what I want to do is gradually fill that space. And the patients tell me this really doesn't hurt. It's kind of a weird feeling because it's just filling it up, but it's not painful. It's not a needle. I'm not going to hit a blood vessel. I'm not going to cause a bruise. And it really gives that immediate improvement in her appearance. So that's half a cc. I think if you see now, you can see how she's flat here. Now she's got that nice, very natural look to her cheek, just from a half cc of Voluma. No bruising, no pain, just a very simple procedure to give her that volume back. Now I'm going to go over and do the same thing on the other side.